Good morning, everyone. Today is Thursday, May 31st, the last day of May. I can hardly believe it. Thank you so much for joining into our weekly webinars. They are hopefully a place that you found that you can come for answers, for information on what's going on the federal level and the state level, and with the carriers. So hopefully after all these years, you find them still valuable. I do encourage you to ask questions. In fact, it doesn't have to wait until Thursday mornings. If you have questions or topics that you want to hear more about or learn more about, then just shoot me an email or give me a call. I'm happy to add that to the agenda. If you are new to the format, my name's Deb Wilkinson. I'm the Vice President of the Health Plan Options Department. And again, you're encouraged to ask questions. You can do that in one of two ways. You can in the control panel to the right of your screen, you can raise your hand icon and I'll unmute you at the end of the webinar and you can ask your question live, or you can type it in the question box and I'll answer that at the end of the webinar as well. So with a simple show of hands, your electronic hands, if you can just let me know if you can see my screen and hear me okay, I'd appreciate it. All right, good. It's always a toss-up if I have technical issues. So let's just get right into the agenda. Senator Bill Cassidy from Louisiana hopes to introduce legislation to mandate price transparency, easy for me to say, price transparency to enable patients to compare prices prior to services. He released this in a white paper, and within that, he also mentioned, again, about the state block grants and RX price transparency, also wants to introduce a ban on gag clauses. The gag clauses prevent pharmacists from informing patients that they could save money by paying cash versus insurance, which is quite interesting. So, I think some of those things, maybe all of those things are can help, but wanted to at least pass it on that it's in the works. There was an article about the estimated increase in individual plans for 2019. Average is 15%. Doesn't seem terrible when trend is about 12%. But when you compare it to, pardon me, the pricing that we had as far as increases, for instance, nationally, 25% in 17, 34% on average last year, which was ridiculous, and then another 15 for next year. That's a heck of a lot of increases in a short amount of time. Thus, the high prices on the ACA plans. It's unfortunate. Remember, next year the tax penalty is zeroed out, so there will be no payment if somebody does not get individual insurance that is considered qualified from the federal government in 2019. Again, we've talked about the short-term medical plans and how I feel that would be able to really kind of take the place almost for the healthy folks to get have an alternative option other than an unsubsidized health insurance plan. New Jersey Governor Phil Murphy signed the New Jersey Individual Mandate Bill on yesterday, actually. This law will assess a tax penalty as of 1/1/19 if they're not covered by a qualified plan. What that qualified plan would be at this point is still the ACA plans. It's interesting that they're mimicking the penalty that is in place this year. It's 2.5% of income, or the average cost of a bronze plan in the state of New Jersey, or $2,085 per person, whichever is greatest. So, again, that's a change. That's the second state that's done that. Massachusetts has had the penalty since 2006, if we recall what started it all, Romneycare, and penalties for not having insurance. If you can even go back that far and remember some of those conversations. But, so this is a second state. Not sure if any others are thinking about it or getting close to passing, but, I thought it was worth mentioning. Another interesting stat is that Virginia just signed the law that they're going to be expanding Medicaid. That's the 33rd state in our union to expand Medicaid. So, you know, the ACA did exactly what most of us thought it would do, is create a single payer and expand Medicaid, and it's done a good job of that. Not a great job for other items. So I'll get off my soapbox now. Let's talk a little bit about the Highmark bonus programs. We talked about this the last couple weeks, because for July 1st through December 1st effective date, for groups, new groups that are 2 to 9 lives, you get $120 per group, and for groups of 10 to 50, you get $240 per group. Large group Lehigh Valley bonus is available for groups of 51 plus. That bonus is based on the number of enrolled lives. It starts at 5 to 9 enrolled lives at $350, up to 500 plus lives at $10,000. That information is in my newsletter. So if you are writing Highmark, if you're writing Highmark in large group as well in Lehigh Valley, then take a look at that bonus, because that's certainly lucrative and going to give you a nice dose of some revenue. Geisinger is also offering a bonus program, and if I can find my information, there's this kind of twofold. There is, through August of this year, you can earn a one-time payment of $25 per subscriber on any new group sold in the 1 to 99 market. And again, that's through August of this year. If you sell 200 or more new subscribers in the market segment, you will get $50, a one-time bonus of $50 per subscriber. So that's certainly, and that's new groups in Lehigh and Northampton County. Also in Lehigh Valley, for Lehigh and Northampton, they're offering an increased comp. So if you write a new select and extra group from October of 17 through August of this year, your PEPM commission is $40 as opposed to the $15 for that level. And then if it's a renewal from October of 17 through August of 18, you would get paid 24 PEPM, and the bonus is on top of that. So again, if you are writing Geisinger, you're writing Geisinger in those counties, then take a look at those bonuses, because again, you're going to get some nice little bonuses there. Upcoming events, June 5th, which is Tuesday, CPHU is having a seminar here at URL. It is a CPHU seminar. They're just using our facility. That's from 8 to 12. There's breakfast planned, and there are 3 CE credits available. The registration is in my newsletter again this week. So if you have an interest and want to learn more about CPHU, which you'll have a more comprehensive legislative update on Tuesday, and also learn a few other things, as well as get some CE credit. So if you are interested, sign up for that. It's $20 per NAHU member or $40 for non-members. June 19th, the Life Markets Department is offering a seminar from 9 to 12 on how to cross-sell life insurance to your Medicare clients. They're also offering a life summer bonus. So if you have any interest in learning more about that, reach out to Matt Alina at extension 141. We offered or threw this out a couple of weeks in a row, and a lot of our agent partners are taking advantage of it. Colonial Life is offering to sit down with you and go through your group block and discuss opportunities on where you can add some voluntary or employer-paid programs. If you are interested in setting up a time slot with Dina and Brent, email Elise at elisef@urlinsgroup.com. Just to note, Lisa Margiotti, who was kind enough to do a webinar for us 2 weeks ago, is also offering that same opportunity. And, you know, again, there are advantages and disadvantages to each of these carriers. So if you have interest in meeting with Lisa and at Sun Life to discuss the same opportunities, then just reach out to me and we'll get something set up for you. That really brings us up to the end of the agenda. Hopefully you have some questions for me. And as always, I certainly thank you for joining in. Our next webinar is Thursday, June 7th at 9:30. So let's see if we have questions. I don't have any hands up right now. And questions? Jody is saying they can't hear the webinar. So hopefully people have heard me, because I'm done with the webinar. If you did not hear me, I'll make sure that I re-record and get that out to everyone. And as always, I thank you so much for joining in and appreciate the time that you take to stay informed. And I wish you all a great balance of the week and a wonderful, wonderful weekend. Thanks. Bye-bye.